Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the show.
Slide in.
Welcome, Dr. Gwen, to the studio.
Just in time. Oh, man.
If only you could have seen
Busy Monday.
how close that was.
Whoa. Man, you almost got started without me.
Yeah, well, actually, I did go ahead and start because the music and everything went. So we've got comments because we started late, and you can see that.
My fault. I'll take
no,
the hit on
you're
that
fine. You were doing your job. So we have Aldina Dutra saying "Estu vendo y now astindo," mean that she's watching, but she's not watching because we hadn't started yet.
Okay.
That's Portuguese. And then Rusty says hi, and then translation. He's trying to get Aldini's translation, which we know what it means. You were watching, but you weren't seeing us.
Because we hadn't started.
Because we had to start.
I get it.
We started at 4:30, and you were watching at 4. And then of course we have. Oh, we need to be able to see the chats, don't we? Lindsay!
Grinchmas.
Lindsay, you see that's a super chat? Look at that.
Oh, look at that.
See that? Isn't that cool?
Oh, that's like
fancy graphics.
bling bling.
Whoa. And that's actually just free plugins that anybody can get.
Look at that.
Well, you have to have the computer and some hardware.
Grinchmas. So are we supposed to be the Grinch, or are you the Grinch?
It's supposed to be, I don't know,
Lindsay,
it's supposed to be green. Thank you. Nonetheless, thank you, yes.
Happy Grinchmas.
Thank you.
Christmas is a week away. Sneaking
how
up
about
on me
that?
there.
Boo. Thank you, Lindsay and Twine. And that helps keep us supercharged with the Dutch Brothers that we get
That's
before
what I
the show.
forgot to bring in. I was in such a hurry.
Do you want to go get it? I'll talk about it.
It's all right. That's all right.
Well, everybody will feel
I
bad.
already drank like half of it in like 30 seconds. So.
And it was
because
warm.
I was so-
It was hot enough?
It was still warm, yes.
Yeah, he was doing real doctor work with a
busy day.
patient with real needs. So good for Dr. Gwen. We would like to talk to you on this show about nattokinase, specifically in the setting of COVID, long COVID. We will get to that, and you can skip ahead to that if you only came here to watch that, and you're not watching us live. But those of you who are watching us live, you're the lucky ones because you get to be a part of this conversation. And please chat in your comments and questions, and we'll look at some of them. We'll ignore others. This is how it works.
Thus far, they've been great.
Let's show you what kind we look at. Let's look at this one again. Lindsay and Twine, $20 super chat. Yes, thank you, Lindsay. And you can see she's a member of the channel with that little icon by her name there.
Right.
Located right. See, I can show people where it is. That's what shows that she's a member of the channel. But she's also on Patreon, so that's pretty cool too. We are talking about nattokinase, an enzyme, one of those natural supplements that you get through the health food store or whatever.
Right.
That came about because I had a patient this morning who was having continuing symptoms after having recovered from COVID. So it's been about a month out, which really is still,
Not uncommon.
a lot of people will be getting over symptoms that they're having 1 month out. So we didn't get too excited about it. We didn't get into the conversation. Yeah, we really didn't even get into the conversation about nattokinase because it's not at that point yet.
Sure. Yeah.
Well, why don't we just jump right into it?
Nattokinase.
Why am I not excited
What
about
symptoms
nattokinase?
was this person?
It was just fatigue.
Fatigue. Yeah, that's a common one.
Because he had chronic respiratory issues, shortness of breath, cough.
Before.
Yeah.
So those probably are persisting as well.
So
the fatigue.
So it was really just the fatigue, which is a big part of what people have when they have a diagnosis of long COVID. And I'm sorry, I don't have right in front of me the formal definition of long COVID, but I believe it's symptoms that you had that came with the COVID. There's some respiratory ones like cough, shortness of breath, wheezing. Fatigue is a common one, headache or other neurologic symptoms.
Yep.
But there may be a more complete list than I'm giving. And then there's a definition of how long after you recovered or when you were first infected that it's still going on. It's somewhere around 6 weeks.
I was going to say, I think it's like 4 to 6 weeks, something like that. Yeah.
So
it's not unusual to have a longer drawn out viral illness with COVID that can last 3-4 weeks. That's not unusual. We're not calling that long COVID. It's the things that persist beyond that just don't get better.
And what's interesting now that we're after the big COVID initial onslaught on the world, that we're looking at the whole situation and realizing, oh, wait a minute, we've been seeing this. We were seeing this before COVID. People with these same symptoms.
Similar like chronic fatigue.
And it was getting attributed to different things. Oftentimes Lyme would come up.
That would be a big one.
For Lyme and say, I have chronic Lyme. And of course, if they did get a test, whether it was positive or false positive, that was something a lot of people latched on to as an explanation for these same symptoms. Fatigue that goes on and on and on, or other neurologic symptoms. And now we're able to look back at it and see, oh, wait a minute. We're seeing a whole lot of this
maybe
all over the whole world all at once after COVID. We were seeing it before, but not having a single cause of it that we were able to put our finger on. And so there's speculation that just simply viral upper respiratory infections may have been the cause all along for these same type of symptoms we're now calling long COVID after somebody just
long COVID,
whether it's from COVID or influenza or something else that's going around right now.
Well, we used to call these things chronic fatigue syndrome.
That was one,
Fibromyalgia has some crossover there.
Absolutely.
But those are, and then a lot of people, chronic Lyme disease, which again, as you explained, is not always,
people who hadn't even had
probably
an exposure
not be attributed to Lyme.
But all right, let's see what else we got here on the chat, because the chat is open. And we've got Janine Larson. I have been diagnosed with long COVID. It's been 3 months, cough, and still on oxygen.
That's a
little more serious
significant.
there.
Long COVID that you're having there, still requiring oxygen 3 months out. Wow. I'm sorry to hear that.
There is still hope that this will get better over time.
Yeah.
Which is hard to tell a person that's
right in the middle of it, on oxygen,
having to deal with that kind of stuff.
Breathing,
you always worry, well, what if I'm, the small percentage that
it persists.
And you don't know. So we are sorry for Jeannie, for what you're going through there, and we do hope that it does go away for you.
At my church who had long COVID, and his consisted of just copious secretions and mucus, almost to the point of where he was drowning. He'd have all these.
Did it go away?
It's gotten better. Still hasn't gone away completely. And
came on with COVID.
I think 6 months out.
So since
it was with COVID. It was directly attributed. It was fine before COVID and then had it. So.
And then Lindsay Antoine also says, I have always heard getting a definitive diagnosis for Lyme is quite difficult.
Chronic Lyme is probably, that's what we're talking, and chronic Lyme is a misnomer. For acute Lyme disease, if you're in the northeast, Connecticut, Massachusetts, those areas where Lyme is common, Lyme is diagnosed quite often. Acute Lyme, where you get the,
and she's in that area,
you get the rash. That can be.
Plus, you can check titers.
And you can get titers, for acute illnesses, IgM, as it were. So and then that's diagnosed pretty easily.
That was okay. We're caught up on the. Oh no, Laura Barzyk.
He showed up.
Laura Barzyk telling us that she's late, but she's here. So, Laura, just for your benefit, you alone. We're talking about nattokinase for long COVID. We've already established that long COVID is similar to what we had before COVID, with these syndromes of fatigue. Quite often is the main symptom. Sometimes some other neurologic symptoms. With COVID, oftentimes respiratory symptoms. And now we're at the point of, does this natural product called nattokinase play a role?
Right. Oh, and that's not the only one. You're thinking about chronic. It's almost like this is such a new thing. We're just throwing everything at the wall and seeing what sticks, essentially. So the long COVID thing, because it's a new diagnosis, nattokinase, and there are some other things that have been postulated that may help, and that they've been doing research on to try to figure that out. Now, that being said, the chronic fatigue syndrome, fibromyalgia, those are things where we've almost had a similar type thing where we've just said, okay, how are we treating this? And we don't have a lot of great treatments for them. A lot of it is just based on physical therapy, some antidepressants sometimes, things like that. that can help.
So the reason nattokinase came up was because we thought we had seen a clinic that we were sending people.
Somebody had recommended
for long
it.
COVID. Somebody actually recommended this to a patient. So that's why when I had this patient come this morning, I thought, I need to look into this.
Yeah.
I'll jump into
Hey,
the
we've
literature.
got something we can give you.
See what
Wouldn't
we
that be
have.
great?
Up to date does not have anything on it whatsoever.
Yeah. Up to Date is a resource that we use that kind of looks through the available data or publications and then comes up with that. And it also relies a lot on
And it may not
professional
be up to date.
recommendations. Yeah, it may not.
It's
they don't
possible.
recommend it or update it like every.
It's possible that
every
there would be
month.
something in it next time it gets updated. So
Yeah.
I'm not saying it's absolutely not there. But then I started looking around other places. I looked at Consumer Labs. I have a subscription to that independently tests these products that aren't controlled by the FDA, these natural products, and this enzyme is one of them that's sold by different companies. The Vitamin Shop was one of them that was mentioned that sells it, that I think got
Usually
their
where you
approval.
find them, yeah.
And funny, it didn't even mention a claim for COVID.
For treatment. Oh.
It mentioned other claims for nattokinase. So maybe that it's not up to date also. But specifically for overcoagulable situations
Hypercoagulation.
and for blood pressure control are things that it's been looked at.
Sure.
It looks like it was indeed found to have effect on blood pressure, reducing in one study the systolic about 5 points and diastolic a couple points.
That's something.
Yeah, I think I'd rather take something that's going to get it
A little more
down and
bang
make
for
a
your buck
difference.
there.
But yeah, it did show some degree of doing something, which is
Yeah.
I'm going to sneeze.
Off camera. Get out of here.
Yeah, I got
Mute.
Yeah. Oh,
Stop.
it went away. Never mind. So disappointing. Maybe it'll come back.
Yeah.
So
Yeah. So the whole food supplement, vitamin, mineral, whatever you want to call them, industry is completely unregulated. First of all, the FDA
Wild-
doesn't touch it, and that dates back to I think some rulings in the 70s and 80s. Where there were some
off.
very there were some very strong influences in lobbying from the supplement industries where they said, hey, keep your government hands off my supplement. And there are some laws on the books where the FDA literally cannot make a claim one way or the other.
interesting.
But and actually I was listening to a great podcast on that. There you go. I'll just leave you hanging there because I can't remember the name of it. Maybe I need a supplement for my memory.
It'll get you one if you can remember to take it.
If I can remember to take it. I can't remember.
So
I can look
the
it up.
nattokinase. So Consumer Labs showed some studies that it actually did make a difference in blood pressure. Very
The Dream.
modest.
There you go. Check it out.
What's it called? The Dream?
The Dream. Yeah, I think
The
it's
Dream.
the second season. Anyways.
And then the other one was, does it make a difference for decreasing blood clots, like in the setting of heart attack and stroke, or maybe even pulmonary embolism? And they didn't find that clinically it was doing anything helpful there, even though it does interfere with, or helps with fibrinogen, fibrin conversion.
The cascade.
It does have some activity there, but clinically, as far as benefit, none has been proven.
Okay.
The blood pressure is the only thing that they showed it did a little bit of something there. And then absolutely nothing about long COVID.
Sure.
So
Because it's not up to date.
this was the Consumer Lab.
Consumer Lab.
So they have some that they recommend. The thing that they said to look for was a lot of them will say how many milligrams of nattokinase, but that doesn't equate to actually enzymatic activity, that you need that measurement.
I was going to say that doesn't always equate to what's actually in the pill too. But,
Okay.
but that's another thing.
Yeah,
even
only
consider.
7 out of the 9 they tested got their approval.
Oh gosh, we're actually having what
For
they
actually
said they
having
had
what
in
they
it.
said and not having lead or whatever. So
Gosh.
I think Puritan's Pride, Puritan's Pride was on the list. I don't remember what they
Puritan's
said
Pride.
about it. Vitamin Shop was the one that it was interesting because they showed that it didn't list its enzyme activity, but when they tested it, it was actually quite high. So if you're going with the
Interesting.
Vitamin Shop, even though it doesn't show its activity, Consumer Lab says, yeah, it actually has it in there. So if you're doing it for, I guess at this point, the only thing that people would be, after what we said about it, would be using it for would be for blood pressure.
Blood pressure. From
But
what
again,
we're
we want you
seeing
to do that through your doctor.
Yes.
let them know that Consumer Labs has a study that showed that it made a measurable difference.
For those with very mild
If you feel like taking a
elevations.
pill for not making that much difference, but
5 million.
yeah, 5 millimeters
Yeah,
mercury on the
millimeters,
systolic,
yeah.
2 or so, 2.5 on the diastolic,
Yeah.
on the doses that they tested it with. So know that we're usually trying to make more of a difference than that when we prescribe losartan or amlodipine or
Usually,
one of the
yeah.
other usual medicines that we're prescribing for it, and possibly getting some other benefits.
So, was there a study done on nattokinase?
So
long
nattokinase,
COVID.
when I looked on, I did a search on the NIH website. What's it called? Where they have all of the
PubMed?
studies. Yeah, PubMed.
He needs a memory supplement.
I
too.
need that memory supplement. I keep forgetting to take it. They had a list of one of the article I looked at had a list of all these different supplements in addition to nattokinase, including not
Like I
only
said,
supplements,
trying
but
to figure
even,
it out. Yeah.
I read the list to you. Quinine was on there.
I
Hydroxychloroquine
think you said
was on there.
ivermectin.
Ivermectin was on there. You know, all the usual suspects when it comes to COVID. And then I looked more at this article that was listing all these things, saying that there was this whole list of things to consider to use. It really wasn't convincing me. And then I was reading about why, you know, the preamble to the article,
Oh, sure.
the introduction,
Oh, yeah, you
the
showed me that.
background, and it's saying things that, and we had to chase this down too. It was quoting, it was like a Spanish name for the vaccines, vacunas. So it's referring to vacunas. I guess maybe one of the authors was Spanish speaking. I don't know why. Vacunas, with a report that was claiming that
83%.
it said that.
I
Didn't
remember because it was so outrageous.
83 was it 83? Oh, I can't remember what it was. 83%
83%
mortality of people who got the COVID
No,
vaccine.
it wasn't
Is that what it
mortality. 83% was people who had some sort of long-term effect from
the vaccine.
Yeah,
Just a ridiculous.
which is a claim that is not
So we-
substantiated.
So this is where the show takes a turn. that was wow. I mean, we see patients who say, I had a vaccine injury, I had the vaccine, and this is the symptom I have.
Yeah.
I'm thinking of one patient in particular, and I believe he is on nattokinase.
Okay.
And according to him, it has resolved the neurologic symptoms
Okay.
of his long COVID. So just throw that out there.
There you go.
And I don't remember who he's getting the nattokinase from, whether it was a neurologist or
Pulmonologist.
pulmonologist. I don't remember which. Is there something new on there I need to interrupt the show with here? Okay, sorry.
Interrupt this broadcast.
We interrupt this broadcast to show that Laura Barzyk.
Hey! Mary.
Laura! Wow. Okay, let's just leave that up there for a
Look
while
at
while
that.
we talk. Okay, thank you, Laura.
Thank you for joining us.
Wow, you and Lindsay, thank you. Very, very kind. This is cool.
Yeah.
Makes me glad we did a show today. Okay, back to the nattokinase thing and this 83% long-lasting some kind of vaccine adverse effect.
Yeah.
So we're always telling people don't go by anecdotal accounts, anecdotal cases to prove anything. But saying that 83% of people who got the vaccine, which is more well over half of the people in the world, first of all,
Yeah.
and in our office, are having a lot. That's a lot of people having something go on that we're working with in our everyday, and it's just not coming up.
And I remember when we initially got our vaccines, do you remember you had to fill out that little questionnaire? Yeah,
vaccine
VAERS.
adverse events.
And then they send it to you
system.
4 to 6 weeks later, and you had to
And they
fill it
kept
out
asking.
again and kept asking. They were tracking this stuff very closely.
I remember that. I
Yeah.
remember getting a text.
'Cause
They would ask
they
me
wanted
about
to know.
any symptoms, and I would answer it. No, I'm fine now. Just first couple days, I felt headachy, and
Right.
So they have that data in the VAERS system in the United States. This study was supposedly looking at the Netherlands, where they had a higher than everywhere else rate of
Uptake.
adverse effects from
adverse
vaccines.
effects.
And
What's going on in the Netherlands?
So we found some things. We found a problem with blood
Crazy
clots
Dutch.
in women of a certain age, and that was with the Janssen,
Yes.
which wasn't one of the mRNA vaccines.
No.
It was the virus one. So that was a concern. In fact, I don't even see the Janssen vaccine used in the United States anymore.
Yeah, I don't think it's even available.
But the mRNA ones, we got those. We filled out our VAERS, and we've been seeing patients who have them. And I got to tell you, this claim of 83%
something.
long-lasting adverse effects to the vaccine is just not what we're seeing clinically. Maybe I shouldn't even say that, because I tell people not go by anecdotal. I tell them to go by what the studies show. So
we should track down the VAERS data.
So let's
That's what
talk.
we should do.
We have talked about it throughout the years.
Yeah.
When it's come up, but it was not showing this. I'll tell you that. It did talk about the
would have
blood
been
clots, though.
significant.
The
Oh,
blood
absolutely.
clots, and also some cardiac things in
young men.
adolescents, and when they compared it to the baseline level of it,
It was not that significant.
it was roughly the same amount. So that takes us to, okay, what's this vacuna? So I started looking at it, and I found that the English translation, Vaccines, it's actually a journal.
Mm-hmm.
And in 2021, a large portion of its editorial staff, including the founding editor-in-chief, all resigned at the same time in response to an article that got published by Vaccines.
Really?
And that's where this 83%
And that was wow.
They're quoting in this other
The one that
article that I was kind of scratching my head because it was giving information that just didn't, and it was in a journal I'd never heard of. Curious. Like cure, not like cure for a disease. Curious.
Because you know your publication is reputable if it uses a pun.
Okay, that's good.
Just saying.
You know that's the place to get your medical information. So
That's where
the Curious article
The curious.
was making reference to the vacunas or vaccines article, which caused even the founding editor-in-chief to resign from that publication.
Man, we're getting into some.
Because of this 83%.
Yeah.
And so eventually it got withdrawn.
Okay. So they're quoting an article that got withdrawn.
A study that got pulled off.
Wow.
And then the editors and the editor-in-chief came back when they saw that the managing staff appropriately took action.
Sure.
And what happened was they were not, I'm trying to remember how it was. It was all comers, and it was not at all filtering out the baseline level of whatever the symptoms were they were looking at.
Oh, okay.
From other people. Still, this
Gotcha.
83% sounds like a lot for that.
It does, yeah.
Yeah. Anyway,
Yeah.
they looked at who published the article and the authors. None of the authors were either vaccinologists or people in the field or virologists. They were people from other fields that were handling the data and really did a misrepresentation of the data.
Okay.
So that's where that came from.
Wow.
And so that's kind of the world that I'm seeing the nattokinase coming from.
Oh, man.
So it makes me very hesitant
Very suspect for sure.
to recommend the nattokinase. I was very hopeful for it when we saw that. We both saw that somebody at the pulmonary.
Yeah, they had recommended it. Yeah,
was recommending it. So maybe we need to talk to
Try to see where
specifically that pulmonologist
they're doing
or
that.
infectious disease specialist, whoever it was, and get some more information on. Okay,
Sure.
Are you seeing improvement different with this than with placebo or anything else that a patient is doing? Because watching long COVID over time, most people are eventually getting past it.
Right.
So then the whole field of vaccine injury and the same symptoms from that as from long COVID
Yeah. What's the...
I'm just not seeing it either in the studies or clinically. I have one patient who's, and I'm pretty sure it's been reported to VAERS,
Yep.
who's saying that he's got these ongoing symptoms from the vaccine. And of course, with VAERS, you would be able to tease out, is this different from people who didn't get the vaccine?
Right. Yeah.
Or people before they got the vaccine?
Yeah. Yeah, we've had, many people take the vaccine, and
We're talking about the COVID vaccine.
COVID
specifically.
vaccine specifically without any issues.
Our entire families,
Yeah.
both sides.
Both sides, and just patients, that
patients,
come
yeah.
in, lots of them, and yeah, I can think of
So,
maybe 2 that had adverse events. They happen.
yeah. So we wanted to walk you through that journey of nattokinase and its proposed help for long COVID, which we're just not finding in the literature to
Yeah.
be supported. Okay, so that is Laura Barzyk,
I think we're up to...
Mary Grinchmith's Dutch donation, and we will. Oh, you know what we're supposed to do?
What are we supposed to do?
We were supposed to. I say we're supposed to. So there's this, my translations of. There's supposed to be this
What we're
way.
supposed to do.
Yeah, I don't think anybody wants me to find out how to do it.
What are you doing?
We're supposed to find a way to insert YouTube ads in the middle of our stream.
Oh.
I keep telling it, yeah, I'll get to it. Well, we'll get to it. You get the show with no
not
ads.
today. I mean,
thanks to
we
things
had
like Laura
2
Barzyk and Lindsay
very
Graff.
generous.
How would we put an ad in a show where they
not
do that?
today.
No.
We appreciate.
Can't do that.
you guys.
Yeah, absolutely. So until next time,
Hey, I'm Dr. Dwayne Baugh.
Dr. Mark Vaughn, have a great Christmas
Yeah.
and New Year.
Happy
and
holidays.
We will be back. Maybe
January.
New Year. It's a break. We're taking a break.
Yep.
You enjoy your time. I know you'll miss us terribly.
Go watch
miss you
all of
too.
the old.
So until next
Videos.
time,
I'm still going.
he's still Dr. Mark Vaughn telling you to stay in good health.